We had already covered our first part of this lecture, and now we are discussing the second part of this vascular hypertensive disease. I will discuss the morphology of the vascular changes and renal changes in the hypertension and what are the role of the renal system in the maintenance of the blood pressure. Okay, so discuss what is the morphological changes in vascular system. First, it can cause arteriosclerosis and atherosclerosis. Okay, arteriosclerosis. Arteriosclerosis is a small vessel disease. Okay, in the arteriosclerosis, it causing the three small vessel diseases like hyaline arteriosclerosis, hyperplastic arteriosclerosis, and fibrinoid deposition of the arteriosclerosis. Okay, so we'll write like is a disease of the small blood vessels. Okay, there are three diseases related to this arteriosclerosis. First is hyaline arteriosclerosis. Okay, so what happened in the hyaline arteriosclerosis is the homogeneous pink hyaline thickening of blood vessel which is also associated with narrowing of the lumen. Okay, so we will write is the homogeneous pink thickening associated with the narrowing of the lumen. Okay, so we will discuss mechanism of the action. Okay, so in this hyaline arteriosclerosis, leakage of the plasma protein across the injured endothelial cells. Okay, and then synthesis of the smooth muscle matrix in the hypertension disease. Okay, so it causing the hyaline change in the vessels wall. Okay, leakage of plasma protein, leakage of plasma protein across injured injured endothelial cell. Okay, and there is also synthesis of a smooth muscle matrix. It can cause nephrosclerosis and glomerular scarring. So we'll write consequences. Glomerular scarring. Okay, and nephrosclerosis. Then hyperplastic arteriosclerosis. Second is hyperplastic arteriosclerosis. So vessel is exhibits concentric laminated thickening of the vessels wall and narrowing of the lumen. Okay, concentric like not a small bulging in the lumen, then the concentric narrowing. Okay, and third is fibrinoid deposition. These occur in the malignant hypertension. There is a deposition of the fibers and it causing the stiffness of the vessels wall and narrowing of the vessel lumen. Okay. So we discussed morphological changes in the hypertension, and now we discuss what are the renal changes in the hypertension. Okay. So the most important early clinical marker for the renal failure is the hypertension. If the patient has a hypertension, definitely it will cause a renal failure if it is not treated. Okay. So this is the early clinical marker. Okay. And then it causing the microalbuminuria and macroalbuminuria estimated by the radioimmunoassay. Okay. What are the renal changes in the hypertension? So, firstly, we will discuss how we will say that the renal system is affected by the how we can diagnose the hypertension is responsible for the renal system. Okay. Firstly, we'll discuss a 2 point. There is a marker for the renal failure in the hypertension. So the early clinical marker for the renal failure is hypertension, and there is a microalbuminuria and macroalbuminuria present in the hypertension that causing the renal failure, and this is estimated by the radioimmunoassay. Okay, so we can write then microalbuminuria and macroalbuminuria. Estimated by the radioimmunoassay. Okay, so there is the effect of hypertension on the renal system that cause malignant nephrosclerosis and benign nephrosclerosis. What is the benign? Malignant nephrosclerosis. First, we will discuss the gross feature. Okay. In gross feature, this is affecting the both kidney, reducing the size of the kidney, reducing the weight of the kidney, and surface is fine granulated, okay, and V-shaped area of the scarring. And on the cut surface, we can see free necrotized cortex, okay. Okay, on the cut surface, we can see frame and necrotized cortex. Okay, how the kidneys look. This kidney, the kidneys look like this. Okay, see, if you see in the see in the grossly, there will be a V-shaped scarring. This is the V-shaped scarring. Okay, and this is the five small contracted kidney. See, this is the contracted kidney. So what is the exact size of the kidney? It can be look like this now. So this is reducing. Okay. Now come on. Clinical feature of this benign nephrosclerosis. Okay. So it can present with the headache, palpitation, nervousness, papillary edema is absent. Okay. Renal function test and urine examination can be normal in the early stage. Okay, we can't find this in the early stage, so it present with the headache, palpitation, nervousness. Okay, but papillary edema is not present. Okay, so there is one more note. Renal test and urine examination. It can be normal in the early stage. Can be normal in early stage. Okay. Now come on the malignant hypertension, malignant hypertensive kidney or malignant nephrosclerosis. Okay. What will be the gross features? Grossly how it is appear. Okay. The malignant nephrosclerosis is followed by the malignant nephrosclerosis is follows Benign nephrosclerosis. If the benign nephrosis is not treated, it converts into malignant hypertensive kidney. Okay, so the gross feature will be the increasing the size of the kidney, renal edema. Okay, it present with fatigue and the cut surface will show red, yellow, molded appearance. Okay, pre-existing, benign, and with pre-existing benign nephrosclerosis. Okay, kidney become large, adenomatous, petechial hemorrhage will be present, petechial hemorrhage. Okay, and the cut surface will show the red, yellow, molded appearance. Okay, then clinical features. It can present with papilloedema, hematuria, proteinuria. Okay, uremia, azotemia. This present if not treated. Okay.